Good morning everyone. This is Dr. Saloni Bawlekar from Tooth and Co Dental Clinic. Being the first video for a case discussion actually. So for today I've chosen the topic that is extraction in Parkinson's patient. In dental colleges or dental universities, we generally don't get as much exposure that we should get in handling medically compromised patients or in general handling the medical emergencies. Even though if we get the slightest of exposure, there are teachers, staffs, guides or PCs around you to help you. So what are the key points or what are all other factors that you need to consider? Let's dive into it. So number one, you have already received a medically compromised case. In this case, we are discussing for the Parkinson's patient. So yeah, there's a Parkinson's patient with you. He has a history for it. He's undergoing the treatment for the same. So now what are the key points? First, that we have already discussed or that we have learned in our oral surgery postings, that is, first is you need to note down what all medications the patient is on. Trust me, this is the most important point you need to remember throughout. So first is listing down or jot down all the drugs that the patient is on currently. Second, if there is any tremor history or any episode that the patient was not able to handle on the medication itself in the last at least 30 days. I know there are books and many paper research work which states that you should be stable for the 15 days, past 15 days. But trust me, if you just extend the time to a 30 days time, it would be better for you and a safer treatment for you as well. The third option that we need to consider is whether the patient is allergic to any other drug. So now let's dive back into the topic, that is extraction in Parkinson's patient. Now that you know all the history plus you have got the findings and you know that the patient or the case is definitely going for extraction. So what all things you need to keep in mind? First is the drug. The patient is on L-Dopa. So what happens with L-Dopa is it generally does not react with your LA, but sometimes there is a wearing off effect. The wearing off effect is when you start administrating the LA to the patient. There are chances that the effect of the levodopa might wear off, because of which your patient might experience sudden trembling or there can be episodes of seizures for which you need to be prepared. Secondly, administrating your LA. So you do not always require administration of a block in patients with Parkinson's, because what happens is there are some chances where you might wear off the effect of levodopa. So in such cases, you can always go for an infill. If there are not multiple extractions, a single tooth has to be extracted, which is already mobile. So infiltration is the best option for you. Even though it is a mandibular tooth and you know that it is an anterior mandible or a canine, in such cases you can go for infiltration. Infiltration is also the safest option. So you can consider infiltration in such cases. And the third is the patient cannot keep his head stable. So you always need to instruct the patient to either lie back or rest his head in the back. It's better if the relative or the person accompanying the patient holds the head of the patient or supports the head so that you can comfortably work. Because trust me, if you are instructing the patient and the patient keeps on move or can't be stable, it becomes very difficult to have a grip on the forceps, and there are chances that the forceps might slip and the patient might have some injury. Or the other option that you can do is train your staff or your assistants so that they can hold the head of the patient comfortably in the position that you need, and then you can proceed with the extraction. Lastly, a small tip from my side that I have experienced during this patient is, in this patient, you cannot give a cotton swab or a gauze piece to bite on for 30 minutes because it is very difficult for these patients to hold or clench tightly for so long because of the muscle trembling continuously. So it is better if the wound is very large or the socket is very large, you can go for either sutures. But if the patient is not able to visit again for the removal of the sutures, it is better to do compress the bony plates after the extraction. Second, clean the socket thoroughly with betadine and saline. Clean it so much that you can see that there is no blood oozing out from the wound. And third, again compress the wound and hold it for few seconds, after which you can remove the cotton swab that you are holding the bony plates with, and your patient is good to go home. So yeah, this is Saloni Bavlekar discussing different cases that I am experiencing in my dental practice and helping you all so that you avoid or you don't need to reach out different people as to what to do and when to do. Thank you.